Welcome to Keep Going, a podcast about failure and success, hosted by John Biggs. Every week, we talk to an amazing person about a time they failed and what they learned. And remember, when you're going through hell, keep going.
Welcome back to Keep Going, a podcast about success and failure. I'm John Biggs. Today on the show we have Melissa Hanna. She's the CEO and co-founder of Mahmee, M-A-H-M-E-E, which is a fascinating startup. You guys work with doulas and you work with care during birth, right? So why don't you tell me about that? Welcome.
Thanks. Yes. Mahmee provides wraparound prenatal and postpartum support. We do that with a team of doulas, lactation consultants, registered nurses, mental health providers, and nutritionists. And it's all included in one bundle that's actually covered by insurance. In most cases, we work with most major insurance companies, and the services start during pregnancy, go all the way through labor and delivery, and until baby's first birthday. So it's a pretty comprehensive package of support for new and expecting parents.
So, just tell me why you started this. What was the impetus?
Well, the business has been through a number of evolutions, but the impetus and the vision and mission have stayed true and consistent all the way through. We're on a mission to make the U.S. the best place in the world to give birth. Right now, the U.S. is not close to having that title. Mm-hmm. So it's a big, hairy, audacious goal, you could say, that we've taken on. We're not doing it alone. There are a lot of folks that are really passionate about this space. We work with a number of different health system and health plan partners and doctors, researchers across the country, and of course, a broad network of providers. But I started the business because I was hearing a lot about maternal and infant health statistics, the morbidity and the mortality rates in the United States. And I kept hearing numbers that just felt very wrong, like they could not be correct. And the U.S. is in last place with the worst maternal mortality and also an egregiously high infant mortality rate compared with all other developed first world, wealthy nations, however you want to describe that. We have the best tech, the best know-how, the most passion for providing healthcare to a diverse population. If you look at, just what the United States looks like and the resources we have to provide care to people, and to hear that moms and babies are being failed every day across the country was really shocking to me. And I thought that just can't be right. The more that I dug into it, the more I realized there was a real structural challenge in solving this. And it became more and more interesting to me. And I started pursuing it as a software problem, as a data problem. Could we connect the dots together to figure out why people are falling through the cracks of the system, why systems aren't talking to each other, why providers aren't talking to each other? Is this a communications issue? What kind of software tool set could help provide a better experience, both for the patients and the providers working in the space? And then learned over time that was not actually going to be the answer. Mm-hmm. And therein lies the story of a pivot.
Okay. That's so. And this is especially egregious here in the States for people of color as well, right?
Yeah.
I think I interviewed someone years ago about women's health, and she pointed out that was just abysmal.
Yeah, it is. It's true. Black women have on average rate of 3 to 4 times a higher rate of maternal mortality of death during or shortly after childbirth. This and that's just the average. There are some communities where it is much higher than that, compared with peers with similar clinical profiles, similar economic profiles that are. And so, and that's the case also for Native American and Indigenous women as well. So these two populations really are off the charts in terms of mortality rates and morbidity rates, which is the rate of injury, where there could be a near-death situation or sort of a near miss where something could have gone wrong and luckily didn't happen, but there still was an injury that occurred. In all of these cases, it's really hard to talk about these stats without talking about systemic racism and bias in healthcare. That is a root cause of these disparities in care. What I found in doing this research over several years as I was building the tech company that Mahmee started as was that there were a number of different contributing factors, and that systemic racism and bias was an amplifier. Ultimately, high fragmentation, and really a lack of proactive care, just like the dollars not being allocated to preventative care the way that we need them to be, were two of the other major drivers of this. So I started looking at this from the standpoint of, well, how do you solve for fragmentation? You start to think about information superhighways and information exchanges and connecting systems together, even if you can't necessarily connect the institutions together. And then when it comes to dollars being allocated toward more effective solutions, you think about payment innovation in healthcare and how do you actually redirect funding toward the solutions that have the greatest impact on the community.
So I think this is a really interesting point. I mean, what you said, and I want to hear about this pivot very specifically. The language that you used before for the first iteration was kind of language that I hear all the time from like an entrepreneur who wants to do something in like, I don't know, STEM toys or education. And it's very much like, we can do this. It's a software problem, right? And it sounds like you quickly discovered it wasn't a software problem. So tell me about that pivot.
Yeah. I wish I could say that I quickly discovered that
Okay.
because it's a little bit more painful than that. But I will say that this business being in the healthcare industry has had a different sort of profile and different time horizon than businesses in other verticals that are VC backed and sort of, you come to an idea, you put it in the market, maybe the first version doesn't work, you test it again, and then all of a sudden you're like, oh, this is actually taking off. We did have that experience with our software solution. And I can talk about that in a second, but suffice to say that we saw growth within the software play that we originally developed. But what was happening behind the scenes is we started to understand that the market wasn't actually mature enough. The market wasn't established for scale. So even though we launched something and we did have that moment of like, oh, this is going to be big, when we started to see the development of that business, the signs were there, and they were small and they were sort of early because the market wasn't developed yet to say, this might not get as big as we want it to get. And that was the critical insight. So like I said, I wish that it would have happened sooner, but it took years really to understand first what the software problem was in the market. And I talk about the fragmentation and sort of like the payment challenge. I got emojis there. I don't know. Those are not
Yeah, that's not. It's a bad one. Yeah, okay, great.
But I have to avoid talking with my hands too much. The software challenge was much more apparent because the United States has like so many different kinds of healthcare institutions and so many different ways that healthcare is paid for. That means there's a lot of different kinds of providers that can provide that care, whether those are retail providers taking cash pay, whether those are integrated delivery networks and large systems like the Kaisers and Geisingers of the world that have a much more integrated set of hospitals and doctors' offices and urgent care facilities and all of that, and plans associated with their brands. And then you have sort of your freestanding medical facilities of all different types, and you take your commercial insurance or you take your Medicaid insurance to these organizations, and you hope that insurance is going to pay for most of the care you receive. So there's like so many different ways that people get healthcare in the United States that we first had to figure out, could you build software that could connect these systems together? So we did that actually for the first 5 years of this company's life. And what we realized was that in order to find the missing data that would tell a different story and provide an opportunity to actually improve clinical outcomes within this population, we had to distribute software to a number of independent providers that really didn't have those tools yet. So we're talking about those doulas, those lactation consultants, mental health providers, nutritionists, nurses that are working in the communities. Often they're working in private practice or maybe even a local community center, a nonprofit with some grant funding, and providing those in-between moments of support between going to your OBGYN and your pediatrician's office for clinical care from your doctor, maybe your baby's doctor. There's all these other people you're talking to along the way. And a lot of those people had really important insights, but that data wasn't actually manifesting. It wasn't surfacing in the system. And so that was the key. That was the first insight was, okay, we have to get them online. We have to actually create tools for these kinds of providers. And we did. We created an electronic health record. We created a care management system, a communications tool set, a number of different features that allowed for these providers to provide care in the community. As sort of part and parcel with that, we realized, okay, now to figure out how to actually create more of that market, because a lot of the rich and valuable data was actually coming from these folks. You kind of tell your doula your life story, tell your lactation consultant, the aspects of, your experience that you might not feel comfortable talking about with your OBGYN. Even though we want you to feel comfortable talking with your OBGYN, it might not be happening. And so someone else might be getting that story. What can we do to empower that person with that key information about your health and well-being to be able to participate in improving your care? And so we had to find a way to actually fund these providers getting into the healthcare stack is what I call it, really getting them to be able to participate fully as players on that patient's team. So we had the tech for them. We had to figure out how to actually finance this. When we realized that the payments model for these types of providers was severely broken, that became a major blocker. We said, wait a minute, okay, there's all these people out here that can provide this care and have this really valuable insight and this really powerful way that they can have an impact in the industry, but they're not participating in the healthcare stack, and we can't seem to figure out how to get payments flowing to them because insurance wasn't covering a lot of these services. So the tough realization here was that being a pure software play was not going to maximize the impact, the ability to achieve the mission of the company, the valuation of the business, right? Because there was this blocker in terms of how these services are actually funded to allow for greater participation in healthcare. Otherwise, you've got, all these doctors, hospitals, all these folks that care about you and are providing care to you, but they're missing a piece of the pie over here. And these folks are just out of the system. We ultimately became a tech-enabled healthcare services provider. We took the tech that we had built initially and we started to employ those providers and actually build the scalable healthcare organization that had all of those independent, ancillary, wraparound service providers in-house. Because without that, we just had a market that wasn't scaling on its own. We had to become the scalable player. And now we have become that.
Did it ever get so frustrating that you just didn't want to continue?
There certainly have been moments. Yes. The mission is it's sort of like a well to drink from to restore yourself, because as long as this continues to be an issue in the United States, for myself and for many others, certainly the folks in our company, and I think a lot of our peers across the industry, this is just something that people can't stand, they can't live with. And so, yeah, it's hard. It's hard building a startup, right? It's hard to build a startup in healthcare. It's hard to build a startup for women's healthcare. All of those things are true, but you look at the stats, you look at the economics of the industry. We're talking about $1 trillion market that is healthcare in the United States. Maternal and infant healthcare is approaching a $200 billion market. It's tracking to be on par with the size of the global video games industry.
Mm-hmm. Okay.
To an investor, it's like, well, you could back video games or you could back maternal healthcare. And a lot of people are like, I hadn't thought of it that way. That's part of the problem. And I feel like as long as I'm sitting in the seat I get to sit in and seeing the big opportunity from a clinical impact and also from a financial impact perspective, like, this is where I want to work. This is where I want to build. But yeah, definitely there are hard days where I think, gosh, when is this going to change en masse across the country, especially because there are opportunities globally to take these insights elsewhere too. But there's a lot of work to do here. And as such, there's a lot of value to build here.
What about investment? I mean, I've heard historically it's been difficult as a female founder to get investment. And then specifically talking about maternity, some dude in a vest on Sand Hill Road probably doesn't know a lot about that. So what did you have to do?
Well, I think it's a lot of reframing the opportunity so that people can find an access point into it. It seems big and far away. Someone else is having a not great healthcare experience in some other city, some other state, some other community that you're not a part of. And that can make it difficult for the value proposition to resonate with investors. Ultimately, I both had to learn how to reframe it for accessibility for those investors and also find the investors who it did immediately resonate with, that knew someone who had gone through an experience that could have been better and wondered why it wasn't, and find investors who had had their own personal experience that was not what they expected it to be and started asking their own questions about, like, why does it suck to have a baby in the United States right now? Like, this should not be happening. It shouldn't cost this much. It shouldn't feel this isolating, and it shouldn't be this medically difficult. There's so much risk associated with the care, lots of medical intervention that is not necessarily appropriate in every case. But in other cases, you're glad that there are people with, specialties that can save your life if that's what it comes to. But not every birth should be a life-saving instance of care. And so, a lot of people that I met along the way were asking those questions because they had experienced it or they knew someone who had experienced it themselves. I'd say that's a good portion of our cap table. Ultimately, though, we were able to bring in really strong investors from Sand Hill Road and from Wall Street and bring folks across the country to this work as the business was growing and demonstrating what it was capable of doing.
When you were building this, did you expect to be able to ship some software and then just have the business? Did you expect this along a thing? I mean, it sounds like when it's like trying to rebuild rehab a house or whatever, and then all of a sudden you find a bunch of like broken broken wood somewhere that you have to fix, right? So it sounds like you started digging and hit some rough spots.
Yeah, that's fair. I don't think that I ever imagined it to be an overnight success. I did feel very confident, and I still do, that like technology is a very critical component in solving this problem. And that's why we're ultimately a heavily tech-enabled healthcare service provider. We develop software every day. There are things every day that we're doing to refine the operation and ask questions about how we provide a better patient experience, how we provide a better provider experience through technology itself, and through even connected devices that we use for remote patient monitoring. So, there's a number of different components to this that just continue to persist because the core thesis was right, but the market wasn't ready for it. Actually, you use the analogy of like sort of a house you buy and you find something's wrong with it. The analogy that resonates for me, the movie, the Founder, I mean, sort of the Ray Kroc McDonald's story, like trying to sell milkshake machines and being like, this could be huge. This is a really great piece of tech and everyone should have it for their burger stand. And then, going out to try and sell to burger stands and realizing that none of them had the scale to need this, this great piece of equipment. It was just like not where their heads were at to buy that equipment. And then, him coming across the McDonald's, stand and being like, wow, okay, they've got something here. Like this could actually scale. Realizing that, you couldn't sell the piece of technology until you could find the business that could scale and use it and really, realize the value of it. That resonated when I watched that movie, because that's kind of how I felt going out there trying to like convince, your sort of onesie twosie doula lactation consultant outfits, like, you guys need to get online. Like you need to have a complete set of like, medical software tools to, book and schedule and communicate. Have you guys heard of like HIPAA compliance? And they're like, what? And I'm like, you're going to be subject to, state and federal regulation soon enough. And I got laughed out of so many rooms. Because people were like, no, this is not where we're at. We're not going to need this. We fly under the radar of the rest of the healthcare industry. And I was like, but do you want to? Like, is that where you want to be? Because the care that wraparound service providers offer is so essential to the broader experience that new and expecting parents are having as consumers. And I was like, that's got to be like really valuable. And a lot of people were just like, yeah, no, I don't need your app. And what's interesting is I did find a lot of people who did, and we ended up having thousands and thousands of providers sign up across the country. We were in 44 states with providers using our software to provide care in their communities. And from a footprint, we were like, okay, geographically, like this is great. But from an actual like scale capacity standpoint, like each provider was taking care of like dozens, maybe 100 patients a year, right? So like each person kind of could only do so much on their own, even with a great piece of tech. And we were getting that feedback like, yeah, okay, I see what you're doing here. Yeah, it is right. It is nice to have these kinds of tools and the ability to book and schedule and pay, and, charge people and track my patient's care longitudinally over the course of their maternity episode. Oh, this sounds nice. And I'm loving using it for my 50 clients. And I'm like, 50 clients? There's like, almost 4 million babies born in the country every year. How are we going to actually get to scale? And we ultimately, this vertical integration, bringing people together and saying, well, maybe on an individual basis, y'all are doing the most. You're doing what you can, and it feels impactful. But what if we joined forces and created a team-based model of care? Then what happens? And the amplifier of that really is people are doing next what they were doing before. Each provider is able to do so much more. And the data is living this out. We're taking care of thousands and thousands of people a year because of this shift in operations. Ultimately, that's what we did.
Tell me a story about somebody whose life you changed because of this.
Oh, we get letters every day. We get emails. We get cards in the mail, baby photos. There's so many. There was a mom recently that this was a unique one in that we get a lot of like first time, I couldn't have done this without you. This was amazing. Thank you so much. First time parents. But it really strikes me, and it strikes the team when we get a message from someone who is not a first time parent, who has been through this before and already has, is already carrying the burden of their previous experiences. And this was a young woman, early 20s, with a toddler who became pregnant in a very rural part of the state. There's like one hospital there, one doctor's office. And she found out about mommy being available through her insurance plan. And she didn't know what it was, but she told us that based on what happened to her the first time around and how difficult of a medical experience it was for her. And the pregnancy was otherwise pretty smooth and she was very healthy and like very excited to be pregnant. But once she started to get into care, she felt so judged many times over. This was a woman of color who had said, I just didn't even know what to expect. But I had doctors asking, like, are you ready for this baby? Like, you're really young. And she was still in school. And she was just, she said she had no agency in her initial pregnancy experience. And the labor and delivery was very difficult and she was in pain and everyone was like, well, this is what happens when you get pregnant. Like, what did you think? It's, labor and delivery is not easy. She wanted medication. There was just a lot of bias that was creeping into this experience in a story that was an otherwise medically well patient. And this is not to say that anyone around her like wanted to make her feel bad, but in these high stress moments and when patients are going through their own emotional and physiologic birth experience, like it can be a lot. And then people start saying stuff and they don't even realize sometimes what they're saying to you. I'm not going to defend her medical care team from her first pregnancy, but hearing this woman's story, it just sounded like people didn't know how to sort of control themselves as she's like screaming in pain there and being like, oh my God, the baby's coming. And they're like, okay, yeah, we'll go get the doctor for you. And just this attitude around it. The second time around, what she wrote in was to tell us that she didn't know how many places along the way between her pregnancy experience and her labor and delivery experience, and even in postpartum, she had agency. She didn't know that there were moments where she could say, hey, this is how I want it to go. Like, can we try this? Can we slow down here? Can you give me a second to do some deep breathing? What are my options for pain medication versus, sort of haranguing her for asking for any at all. She didn't even know necessarily what the different choices are. And it isn't just epidural or bust, right? There's a lot of different ways to manage pain. There's a lot of different junctures where a medical decision needs to be made. And if the patient isn't fully empowered and educated in what those decisions might be, the doctors and the nursing team will very quickly start to step in and sort of direct you toward those decisions. And so she wrote in and her message was, I didn't know that there were moments where I could say no. I didn't know there were moments where I could just take a beat and participate in it and direct others around me. And this was very powerful because it speaks to how outcomes actually do change, because there are people who have clinical risk. We take care of a very high-risk population, patients that come in with a history of diabetes, a history of hypertension, cardiac concerns, multiple high-risk pregnancies, right? These are stories where there's already going to be like a whole medical team around this patient. But we're talking about a young woman who has no other history, no other concern, but said, I was so terrified to get pregnant the second time. I thought to myself, oh my gosh, like I want this baby, but I don't want to have to go through what I did before. Ultimately, that narrative is one that we love hearing because it talks about sort of the silent majority of what women are going through in this country, which is to say that if you don't have access to education, support, and provider or a team of providers like you get at Mommy who can empower you to be able to say no, to be able to know what your choices are and how to direct and participate in your own pregnancy and labor experience. There's a whole other storyline that may happen that may lead someone to say later, oh my gosh, that pregnancy was so difficult, or I really didn't enjoy labor and delivery, when it should be a wonderful and empowering and, exciting experience to meet your baby. So that's one where someone said, you changed my life. And what she meant when she said that was very clear that it wasn't just about that maternity experience. It was that someone for the first time in her life said, you have the power. You actually have the agency here and you're in control of you and you have a right to speak up for yourself. And it was, my gosh, we were all moved by that.
Well, that's beautiful. Yeah. So thank you for this. This has been it's fascinating to see a move from pure software play. I'm going to solve this thing. And then all of a sudden you realize there's so much to solve and it comes down to just people, right?
Yeah, that's it. It ultimately comes down to how we care for each other. There are many different ways that people are addressing healthcare issues across the United States. I'm really excited about all of the ways that people are now imagining AI as a component of these solutions, we're doing that work as well. What we found is that it's always been, and it's always needed to be, the combination of people and tech. And so whatever that combination looks like as we go forward, it's that blend of the two, because caring for each other really is where you have transformative experiences, where someone says, like, it only took one person. It only took one person being by my side to help transform the narrative for me. And everyone deserves that. And it shouldn't be something that's a luxury. It shouldn't be something you have to pay through the nose to get. And that's why I'm excited about what we're doing, because it's possible now to give this experience, to make this experience available to a lot more people.
Well, the service is called Mahmee, MAHMEE.com. Melissa, thank you for joining us. It's been great.
Thank you so much.
All right. This has been Keep Going. I'm John Biggs. We'll see you next week. Thank you for listening to Keep Going, a podcast about success and failure. Remember, Keep Going is entirely listener supported. If you're listening to this, please head over to keepgoingpod.com, where you can subscribe to the podcast for as little as $5 a month. This is a labor of love, and every little bit helps. Thanks for listening.